Senators continue to connect the dots on alleged rampant corruption in PhilHealth. But the Presidential Anti-Corruption Commission says it's not just those at the agency's helm who should be held accountable. To tell us more, we have Mean Los Baños. She's reporting live from Mandaluyong City. Mean, how's the Senate hearing shaping up so far?
Charles, more irregularities in PhilHealth were uncovered in today's Senate hearing, and some former officials of the agency confessed to senators that it was corruption that made them give up their position.
Madami na kaming inimbestigahan, kinasuhan, pinatanggal at pinakulong. Pero ang issue ng PhilHealth, grabe po ito. Grabe ang nakawan, grabe ang kakapalan, grabe ang kawalangyaan.
This was how Greco Belgica, Commissioner of the Presidential Anti-Corruption Commission, described the supposed anomalies in PhilHealth, with 2 to 3 billion pesos of the agency's weekly transactions exposed to corruption. The PACC official also pointed out flaws in the agency's IT system, making it susceptible to manipulation by employees and hospitals.
Dahil walang validation mechanism, bayad lang ng bayad ang PhilHealth ng parang tanga sa mga ospital habang naman ang tao.
But it's not just PhilHealth President and CEO Ricardo Morales who should be held accountable, according to PACC.
Mula board, executive committee hanggang sa regions, pending investigations at mag-appoint ng mga OACs para sa araw-araw na operation. Mula ulo hanggang paa ang korupsyon sa PhilHealth.
An emotional former PhilHealth Senior Vice President for Operations Augustus De Villa confessed to the Senate the reason behind his resignation. Aside from wanting more time with his family, De Villa said he gave up his position out of delicadeza.
Hindi ako babagay na magsilbi pa sa isang ahensya ng gobyerno na punong-puno ng aligasyon ng korupsyon at katiwalian.
It was also out of conscience that Etrobal Laborte left his post as Chief Executive Assistant.
Hindi na kaya ng konsensya ko ito, sir. Tapusin ko lang 1-year service, which is sa July, sir, sa PhilHealth. Maraming salamat po. Tapos noong 2016, sir, nag-text naman ako sa kanya, sir. Sabi ko sa kanya, sir, ito yung sa OFW na naman, sir, na issue. Sabi ko, sir, I can no longer work with this kind of people. So I really need to go.
Meanwhile, PhilHealth SVP for Fund Management Sector Renato Limsiaco cried foul over the allegations that he's part of the so-called PhilHealth mafia.
In a dedicated public servant, exposed my family to ridicule in disrepute, and most importantly, affected my elderly parents. Considering the foregoing, I most respectfully request the Senate to carefully parse the allegations of Mr. Cabalig and Attorney Kit and make them accountable for their reckless action.
In the same hearing, senators grilled PhilHealth over the release of funds worth over 9 billion pesos from March to April. These were issued under the Interim Reimbursement Mechanism, or IRM, despite the lack of clear guidelines on how regional offices will use the funds. Morales insisted that board had adopted a resolution as early as January as part of the COVID response, but senators were not sold.
Who is the president or who is the chairman of PhilHealth did not do anything until mid-March. He was even saying that do not panic. And yet an agency under the Department of Health was already panicking, if we are to believe them. So obviously, Mr. President, this is an excuse.
PhilHealth officials also took turns in explaining that the IRM is not only for COVID-19 but for all types of sickness. PhilHealth SVP Rodolfo Del Rosario said if there are doubts of favoritism in terms of releasing funds to hospitals under IRM, they are willing to investigate it.
Region 1, during that date, when that particular document was received.
Charles, Senator Drilon is proposing for a remedial legislation that will give authority to President Duterte to reorganize PhilHealth that will pave the way for the resolution of these corruption issues. Charles?
Thanks, Mean. That was Mean Los Baños reporting live from Mandaluyong.